Good afternoon and welcome to Educating Minorities About Transplants. We're happy today to have as our guest the founder of National Minority Donor Awareness Week and Month, also Day. The renowned transplant surgeon, Dr. Clive Callender, who is still practicing at Howard University, and also he is the founder of Minority Organ Tissue Transplant Education Program. Interviewing him today will be Mrs. Gloria Stevens. She's the treasurer of Educating Minorities About Transplants. We welcome you, Dr. Callender. Let's get started.
Welcome, Dr. Callender.
Thank you very much.
And of course, my first question is going to be for you. What was the most unusual and interesting transplant surgery you performed in your wonderful history of transplantation?
Well, I think the one that I think of more than any other one is the transplant I did on a young boy from his mother. He was about 6 or 7 years old, and of course she was about 35. And so doing a transplant from an adult to a little child was very challenging and very exciting. And to me, it was among my most rewarding transplants. I did my transplant training at University of Minnesota with John Nigerian and Richard Simmons. And so we did a lot of adult to child transplants. But this was the first one I did at Howard University's Transplant Center, which I started in 1973. So of all the transplants I've done, I guess this was the one that was most intriguing and exciting and rewarding to see as soon as you put in the kidney, see all the urine coming out and see the transformation of this young boy after the transplant. So that's my answer to your first question.
Okay, that should have been fantastic.
All the others, my most interesting and exciting transplant.
Sounds like it. It should have been fantastic to place the kidney in and then see the urine flow.
Yeah.
Wow, fantastic. Okay, so if that was your most interesting and phenomenal, and I can imagine that would have been so rewarding because it was a child's transplant. What about your most, and I know things might not be that difficult for you because they might seem easy for you, but what was your most difficult transplantation?
Well, to me, the most difficult transplant I ever did was one in which the transplant wasn't as difficult as was the post-operative recovery. Because I did a transplant on this lady when I was at Minnesota. I'll never forget her because after the transplant and before she actually went home, she had a cardiac arrest, which means the heart stopped beating. And after that first cardiac arrest, she had, you won't believe this, but she had 100 cardiac arrests. And that is hard to believe that somebody would have a cardiac arrest 100 times and still survive. And so this was the transplant that I remember all my life, the one that had 100 resuscitations and yet walked out of the hospital and survived for another 10 years. So that's among the transplants that I've done. That probably one is the one that sticks out to me But, you know, in terms of the difficulty of the transplants that I've done, the liver transplant was probably, without question, the most complicated transplant of all. I did livers and kidneys. And the liver transplant has more connections that you have to do than any other transplant. So the liver was the most complex and most difficult transplant I did, although Doreen Winaka, the lady who had 100 cardiac arrests after the transplant, was the one that I remember even longer than the liver transplants.
I would imagine. I would imagine. Would it be fair to say that she had 100 heart attacks?
No, because what she had was 100 situations in which the heart stopped beating, which is different. Yeah, because a heart attack, the heart may not stop beating. The circulation is bad and you have chest pain. That's a heart attack. So heart may not stop beating. Cardiac arrest is when your heart stops beating. And so theoretically, you're dead. And unless you're resuscitated, that means you're brought back to life 100 times, which I don't think anybody else would believe that it happened, but that's what happened.
Well, it sounds phenomenal. Sounds phenomenal. Yes, that's fantastic. Now, when that happened, did you say Minnesota?
Yeah, University of Minnesota, yeah.
At the
That's
University.
where I did my transplant training.
Okay, okay. Now, have you, sometimes some doctors don't extend the olive branch years after this has happened, but have you had any contact with this person since?
Well, now you got to remember now, that was in 1973. So,
Okay.
so I know she lived for another 10 years after
Okay.
that, but I didn't have the
Yes.
chance. I don't know whether she's still alive now because
Okay.
I haven't been in contact with Minnesota in quite a while.
Okay. Okay. That's fantastic, though. Well, my last question for you is, it sounds like you've already answered the question, though, Dr. Callender. My last question for you is, of all of your transplantations, what was the least likely to be successful and why?
Well, I have, I'd say there are two things. I had a patient who I transplanted when she was a teenager. Mm-hmm. And after the transplant, about almost a year later, she had a rupture of her kidney. And so I went in to try to save her kidney. And actually, by placing some muscle over the hole in the kidney, I was able to save her transplant. So that probably, again, was a very rewarding and exciting transplant. And we feared that we would lose the kidney because the kidney was bleeding, and that was a very unusual situation. And often when you have a rupture of the kidney, which means the kidney breaks open, you're not able to save the kidney, and you're grateful to save the patient's life. But in this instance, we're able to put a muscle patch over the kidney and save both the kidney and the patient. And so the patient then went on to do very well for some 10 years afterwards.
10 years. Dr. Callender, you have a lot of successes walking around. Well, some who have walked around. That's just phenomenal. Wonderful successes, wonderful successes. Very interesting information. Howard University is much blessed, very blessed, to have surgeons like you, LaFall, Dr. LaFall, LaSalle LaFall. You men have just done phenomenal work in the world of transplantation and in surgery. And we are ever so pleased to have you still with us and as vibrant as you are. Thank you. And hopefully, when you go back to Howard, you'll share this video interview with them, your students, and let them know you're still doing it.
Well, you know, it's interesting because of all the transplants that I've done, probably the most interesting experience was a transplant I didn't do.
Oh.
And this was a patient who came in with fulminant hepatitis, which means that the virus is just about kill the liver and the brain is not functioning well. And so the patient was in a coma. And so we didn't expect the patient to survive. Not only did we not expect the patient to survive, we felt that the patient was too sick to be transplanted. And so what we did was we decided that the best thing we could do is to take him off of the life support and other things and allow him to die. However, before that happened, his church people came around and they prayed and laid oil on him. And so what was fascinating as we watched was that as we gave up on him and were preparing to allow him to die, he got better. And he actually walked out of the hospital. And it was my delight actually to see him when he left the hospital. And then 6 months later on the subway, I ran into him and he was doing fine. So that's a miracle. And then of course, I guess my last one is a patient who I transplanted some 34 years ago, who is a transplant recipient and still functioning on that transplant today as we speak.
34 years ago.
Yes.
That's fantastic. Well, Ms. Brill.
God has blessed me far beyond word that can be used to express how God has used me in my career.
Wow, that's fantastic. And we do know that God is a miracle worker and the healer. Ms. Brill, would you please share with Dr. Callender your miraculous situation? And Dr. Callender, you've got to hear this.
Well, Dr. Callender, I am a 12-year double lung transplant recipient, and I've had just a successful life after my transplant. That is why we began the organization, Educating Minorities About Transplants, to share with others, because there are just so many myths, so many misconceptions associated with organ transplants among minorities. And we hope that this will be some type of encouragement to let people know that organ transplantation does work. We do know the statistics among African Americans with kidney disease, and we want to kind of get rid of some of that by spreading the word about the importance of organ donation and transplants. Educating Minorities About Transplants certainly thank you for your time, because we know that you are a busy man. We feel so honored that you have graced us with your presence and that you were willing to share with us all of this valuable information.
Thank you, Dr. Callender.
Thank you. It's been my blessing to join you and share what God has done for all of us.
All righty.
All right.
See you again.
Thank you, sir.
Okay.